So are you confused about menopause and perimenopause? A lot of people are, and I actually, when I started into the transition myself, I didn't know what was causing all of my symptoms, and I never actually linked it to hormones. So what happened to me is around 45 to 47 years old, I started having new onset anxiety. I started having insomnia. I was having weight gain. No matter what I did, I couldn't lose weight. And I'm embarrassed to say this, but I was actually doing 500 calorie a day diets thinking I could lose weight, and I never would. And my symptoms got so bad, I went to my OBGYN and I asked my OBGYN, I was explaining what was going on. She's like, well, let's put you on some sertraline. So they put me on an antidepressant, which made me feel a ton worse. It didn't help my symptoms. It didn't help me sleep. It just made me numb and flat. And I was drinking a lot of caffeine just so I was not so flat through the day. So I went back to her and I'm like, I'm worse. And she said, well, let's try birth control pills. So they put me on birth control pills. That didn't work either. I didn't feel any better. And I still again felt worse. And she was like, well, this is really outside of what I do. So you need to get a primary care doctor. So I got a primary care doctor and he's like, well, let's just try another antidepressant. So they put me on Prozac. I could not remember my name. It was awful. Now, I don't know if that was the brain fog from the antidepressant on top of or plus the brain fog from being perimenopausal, but he was like, we're not doing a good job here with you, so let me send you to psych. In the meantime, not sleeping. I went so long without sleep that one day I had a psychosis event. And so when I got to the psychiatrist, thank God I had a good psychiatrist, because she asked me, she says, has anyone looked at your hormones? And I'm like, no, should they? Because I wasn't having the typical night sweats and hot flashes that people typically think about as being linked to what is perimenopausal or menopausal. And so she sent me to someone who did hormones, and I had no progesterone. I was making absolutely no progesterone. And she said, the reason you're feeling the way you are, and the worst psychosis that I've ever seen has been from a drop in progesterone. So this was really what brought me to functional medicine, was going through my hormone journey, which led to me eventually learning functional medicine. And, I have someone come into my clinic every day and they're lost. They feel all alone. They're wandering around. They cannot get answers. So what I'm going to do today is I'm going to answer, I pulled up on Google or ChatGTP, what are the most common questions women ask? And so I've got the 5 top questions that are asked on Reddit regarding perimenopause and menopause. And so I want to cover those today so I can you can share this with a friend or tag someone who's going through this so that they're not just flopping in the wind and they're not getting completely lost, And another thing that I've found is that perimenopause and menopause is not well managed. It's not a no-brainer. It takes a lot of training and it takes a lot of experience. That's where the majority of the skill comes in, from just doing it over and over and over again. And as I tell my women, this is a season in your life. It's going to be a little bit like hanging a picture in an earthquake. And so it's going to require chronic adjustments. It's going to take a lot of time. And one of the things that I do that sets me apart from other providers is I teach my women how to manage their own symptoms, since hormones are constantly fluctuating and things are constantly changing. So the first question that was on Reddit was, when did perimenopause begin and how were you diagnosed? Well, so one of the things that is misunderstood out there, this is basically terminology. So what does perimenopause mean? So this is the time in a woman's life. Everybody goes into perimenopause. This is pre-menopause. And so it can be, my OBGYN told me, it could be 16 years. It can be first noticed when you're in your early 40s. It depends a lot on when you go into menopause. It depends on if you have had issues with hormones in the past, such as PMS. But it's really a term that everybody goes through perimenopause. And if you're not being symptomatic, you don't really have to do anything about it. It is natural, but we also have the technology and the tools to make things a little bit more pleasant. So how are people diagnosed? You can't really draw a lab, and the reason you can't draw a lab is because the hormones are fluctuating so much during this period of time. You're just going to get one small snapshot in time. So when I found my hormone doctor, he looked at me and he said, what your hormones are today, they are today. What they are tomorrow, they are tomorrow. And so what you primarily need to do is just, if you've got symptoms, then you need to seek assistance in getting treatment. So what are the first and worst symptoms of perimenopause and menopause? That's so variable. There's a lot of symptoms in perimenopause and menopause that are misunderstood, such as fatigue, mood swings, brain fog, night sweats, hot flashes, irregular cycles, heart palpitations. The list is long, and everybody is so variable. You can be so different. For example, if I've had one hot flash in my life, my symptoms were anxiety, insomnia, and fatigue and mood swings, primarily anger. One of the things that I tell my perimenopausal women to know whether or not it's hormones or something else, whenever you're having one, if it's due to your hormones, more than likely you're going to be having it cycle in and out around your cycle. Another thing is it can change. Like 1 month it can be not really bad. The next month it can be awful and the worst month of your life. And I say this jokingly and kind of, kidding. I said, when you can, if you're really crazy, you don't see you're crazy, but when you can see you're crazy and can't do anything about it, that's your hormones. Hormones are very powerful. People don't understand the power of hormones. And I give an example of this is like with the Lorena Bobbitt study. I don't know, or the Lorena Bobbitt trial. I don't remember if y'all remember this. I'm kind of old and this happened when I was younger. But there was a woman named Lorena Bobbitt, and she got into a rage and cut her husband's off in that rage, and she never went to jail. She got off, and they diagnosed her with what is called PMDD, Premenstrual Dysphoric Disorder. Well, that's actually what I had, and I didn't have a single mood swing ever with 3 pregnancies. I didn't have PMS not one day in my lifetime until I hit perimenopause. And then my mood swings were so bad the last week of my cycle that I started isolating myself so that I didn't do something stupid like cuss a colleague out or something like that. And I recently, in the past couple of weeks, I've gotten 2 patients that established care with me for hormones, and one of them was recently diagnosed with bipolar disorder. And I'm like, how long? Okay, so she's made it to 48 years old and never been diagnosed with bipolar disorder, but all of a sudden diagnosed with bipolar. And I'm like, so have you been this way your whole life? She's like, no, I've just started having these bouts of rage that I can't control. I said, that's hormones. And she doesn't need or deserve the diagnosis of bipolar. I also had another patient come in and she was on Lamictal and gabapentin. Now, we're working really hard to take her off these medicines, but hers was all due to perimenopause. And her story is that she woke up in the middle of the night, just sat up straight in bed, and just was engulfed with this anxiety and fear that came out of nowhere without any reason. The first thing they did is they sent her to psych, and then psych gives her a diagnosis and puts her on 2 really strong psychiatric medications that she does not need to be on. We are fixing it with progesterone. So that's pretty incredible. So what should I ask my OBGYN? This is probably one of the most discussed things when it comes to hormone replacement therapy. And this is my opinion. Doesn't mean that I'm right, but this is strongly my opinion. And I've put a lot of thought into this because I've seen a lot of press around this. If y'all are following social media, you see there's a lot of people talking about how poorly OBGYNs are trained on managing women in menopause. So when a patient comes in to see me for hormone replacement therapy or symptoms of perimenopause or menopause, I spend an hour with that patient on my first visit, and then every follow-up visit is 30 minutes, okay? And it takes every minute of this time. And the reason I don't think that OBGYN or hormones should follow under the scope of OBGYN is due to the nature of their job. And I'm just going to give an example. So when I saw my OBGYN a few months ago, I waited 3 hours for him to show up for the visit. Now, out of respect, I did not leave, and I just kept waiting on him. And when he got in there, what had happened, and the reason it took him 3 hours to see me is he had an emergency C-section, and he had an emergency, and it wasn't going very well for mama or baby, and he got in there and he looked so stressed. And I said, I'm so sorry. He apologized for being late. He said, I'm so sorry. And I said, it's okay. He said, I had an emergency and it wasn't going very well. And I said, God bless you. He said, I need God because it was so, and he said it was so hard. Well, we don't need to mix that level of responsibility that OBGYNs take on in what they do when we've got to keep mama and baby alive. Now, I'm not minimizing how terrible menopause and perimenopause can be. I'm just saying we need to understand where to go look for help and whom should really be responsible for it. So if you think about an OBGYN, they've got about 20, they're seeing 25 patients a day on average and weaving in and out, delivering babies and all the things that they do. So when a woman is going through perimenopause and menopause, this is an important time of their life. It is probably some of the biggest transitions that they'll go through in life. For example, many of them have teenagers. Many of them are becoming empty nesters. Many of them are taking care of children at home and aging parents all at the same time. And menopause is so much bigger than an estrogen patch. It is just not slapping an estrogen patch on a woman and you're done. Menopause affects every cell in the body. Your body takes a complete shift from where it was before. You have an increase in cholesterol typically. You have changes to your brain. You have changes in muscle mass. You have it's a system-wide condition. And so to stick that under the care of someone whom has to see 25 patients a day is probably not a good idea. So that's my opinion. So the last question from Reddit, and then we're going to also talk about some key takeaways that I want y'all to understand when it comes to hormone replacement therapy, is the last question is, when did you officially know you were in perimenopause? That was kind of discussed a little bit in the first question, but you will know, you're going to start having irregular cycles. You're going to start having mood changes. Your cycles may get heavier. You may have problems with bleeding. Or the cycles may get shorter, and so, but once again, so perimenopause is just a definition. And so I would not overthink this. If you're not having symptoms, and then you need to then you don't need to worry about it. It is a natural transition that is going to happen. Now, what are some things that you can do to kind of prevent perimenopause from being not terrible for you? Well, it's some of the it's the same things you would want to do if I said, hey, go take care of yourself and go take care of your health. You want to maintain an ideal body weight. And why is this important? Because estrogen fat tissue or adipose tissue makes estrogen. Most women in perimenopause are estrogen dominant. So they have a high estrogen and a low progesterone. And this is what contributes to the psych symptoms. This is also what causes the weight gain in perimenopause. So if you can, try to maintain an ideal body weight. Sleep, get your rest. Sleep is the restorative state of the body. If you're having mood changes, the very best thing for mood cycling in perimenopause is topical progesterone. If you're having insomnia that's not controlled by topical progesterone, you can use oral bioidentical progesterone. You need to make sure you optimize your magnesium. You need to not drink a lot of caffeine or consume a lot of caffeine. You need to regulate your blood sugar, because blood sugar dysregulation can make the symptoms a lot worse. So what does that mean? That means eating meals that are balanced in protein and fat, not just carbs, even though when you're perimenopausal, all you can think about is carbs. You have to use some discipline and mindfulness and eat a balanced diet. Another thing you can do is take adaptogens, such as ashwagandha, things that will help regulate your adrenal function, since it is all linked. So what are the 5 key takeaways that I would like y'all to know about hormone replacement therapy for those of y'all who are contemplating hormone replacement therapy? And my favorite book is written by a medical oncologist, and it's called Estrogen Matters. It is a little bit of a clinical read. It's not a light read, but I think it is very well done. I think this is a place that education is extremely important, because you've got to make one of the biggest decisions you're going to make in your life. Am I going to do hormone replacement therapy, or am I not going to do hormone replacement therapy? So the 5 key takeaways that I would say for if you're considering hormone replacement therapy, is that know that estrogen does not increase breast cancer risk as was previously thought. So the authors of the WHI study misrepresented the risk of estrogen therapy. So what it actually shows is that women who took estrogen alone, no progestins, they had their breast cancer risk was actually lower than placebo. Now that's suggestive, but I'm not going to claim that estrogen is protective against breast cancer. So the risk increases were very small. They were not statistically significant. They were really linked to synthetic progestins, not bioidentical hormones as we use today. And there was no statistically significant increased risk with transdermal estrogen and bioidentical progesterone. So hormones are safe as long as you do not have a contraindication. Estrogen has significant health benefits. It can reduce your risk of heart disease, which is the number one killer in women. It protects against osteoporosis and hip fractures. It can reduce your risk of Alzheimer's disease, particularly when used in early menopause and through the menopause transition. And it can also improve your quality of life, such as mood, sexual health, vasomotor symptoms. Their timing does matter. There's something called the timing hypothesis. Estrogen therapy is most beneficial when started before the age of 60 and within 10 years of menopause. They used to say 5, they're now saying 10. Starting later, there may be some concerns with cardiovascular risk if someone has existing cardiovascular disease. And probably last, but the last point that I want to make, we've had fear-based medicine, and this fear-based medicine has harmed women in the long run. So the WHI study was published in 2002, and at that time it led to a dramatic drop in HRT use, and that resulted in worse outcomes for women with fractures, strokes, dementia, and overall discomfort. The public was actually misled, and this was mostly due to the media's representation of the study, not to the data itself. And as a result, we know that women have been harmed from not being offered hormone replacement therapy, and which I think is tragic. And just to give you the impact of this harm, my mom and my dad both have Alzheimer's, and my mom's word searching started in her 50s, and she also started with some pretty significant mood changes. Now, they lived in Mississippi at the time, and you really couldn't find someone who did hormone replacement therapy at that time. So I brought her to Tennessee, and I took her to a doctor here who specialized in longevity medicine and hormone replacement therapy, and I got her put on estrogen. She had no contraindications. I got her put on estrogen, testosterone, and progesterone, and it totally changed her word searching. She went completely back to normal with her moods. Her word searching stopped, and my sister called me. She says, "I don't know what you gave Mom, but she is back to her old self." When I went back with her to her regular primary care doctor, her primary care doctor was mad as hell that I had done this. And she dismissed my mother from the practice because she was on hormone replacement therapy. I took my mom to her neurologist, and her neurologist said, "Good job, way to go. A lot of women really benefit from hormone replacement therapy, and it can help prevent the advancement of Alzheimer's and dementia." So, that is an example of how the misunderstanding of the safety profile of hormone replacement therapy harmed a human, and that human was my mother.